Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate and provide education from our guests' experience.
On today's episode, we're interviewing Rachel Leigh.
Rachel started her career as a dental nurse before becoming a practice manager and then deciding to retrain as a dental therapist.
I think therapists are going to rule the world. Really, I think now's the time. I don't think there's ever been a more exciting time to be a therapist.
So in the last 25 years, by your own admission, you've worked in about approximately 30 different locations, from anything from local general dental practice to community settings to doing locums, working in environments where the equipment perhaps was not ideal, and again, by your own admission, working somewhere where there were 3 blunt dental instruments, to high-end dental practices where equipment was absolutely cutting edge and you could have everything that you wanted.
If you've been happy in those 2 jobs, then there's absolutely nothing wrong with that. Why do you need to change something that you're not happy with? That you're happy with? Why would you change it?
Yeah.
The only reason we change things, well, maybe I'm a little flighty, but you change things because you want change. If you don't want change, then there's nothing wrong with that. That's great.
We're looking forward to hearing about all of these experiences from that journey.
With your hosts, Josh Hudson and Julia Bruin.
So, Rachel, we'll go back to the start. So what got you into dentistry in the first place? And can you tell us about those early stages in your career where you were first a dental nurse and then transitioned to becoming a practice manager?
Okay. Dentistry for me was a happy accident, I'll call it now. I left school early and was working in a supermarket in a supervisory position at 17, and I really disliked it. So I decided that I wanted to be a social worker. That was my career choice. Investigated it and was told to go and get 3 years experience of life. You can't be a social worker until you're 21 and you've got life experience. So
interesting.
Looked for a job, dental nursing, thought that will do. Took a really big pay cut to go to do the dental nursing job and thought it will fill in my experience of life. And here I am.
So what made you, so you were a dental nurse initially?
A dental nurse first,
and then
yes.
there was some point where you decided to be a practice manager, or did that just naturally happen, or how did that transition occur?
So I was a dental nurse in a fairly big practice, but I noticed that there was a qualification you could do and no one had done it. So in my first few months probably, I put myself onto the dental nursing course and did the dental nursing qualification. And then the practice manager left. I was already doing a lot of the paperwork, blue forms, wages, that kind of thing. So I kind of fell into the management position by accident. Just happened. And then one of the dentists I worked with bought a practice and took me with him, or poached me.
Fair enough.
Yeah, these things happen, don't they? When they spot a good one, they say, hey, come with me. So what then specifically made you pursue a career in dental therapy?
So the new practice I was managing was quite a lot smaller. It was a start-up practice. There was only the dentist, myself, a couple of dental nurses, and I was bored, is the honest truth. I'd gone from a really busy practice. I'd got to what I considered the top of my game. I had a management position and there wasn't really anywhere else to go. And I realised that I missed the surgery side. I didn't really want to be doing
contact.
the COSH reports as it was then, and the admin side wasn't really what I wanted to be doing. So hygiene was the natural progression. It was hygiene I was interested in.
But then therapy sort of crept in there.
So therapy happened by mistake because at that point, therapists couldn't work in general practice. I didn't even know that such a thing existed.
Right.
I had no idea that there was such thing as a therapist until my application form arrived. And then there was a tick box. Do you want to be a hygienist or a therapist? Now, Google didn't exist, so you didn't really get to go and Google and find out what a therapist
life
was.
Before Google, goodness. Yes.
Life before Google, I am that old. I know I don't look it. But so I looked a little bit into therapy and thought, well, it's 6 months more and I'm going to be able to do all of those extra things. So that to me was a no-brainer. So I ticked the therapy box.
Right. Okay.
Thankfully.
So I'm extremely privileged as a dentist to work in a department with lots of dental therapists. I am lucky to teach dental therapists. But I think there's probably a lot of people in general practice and also the general public that don't necessarily know what a dental therapist is. And you mentioned yourself earlier that you didn't know what a dental therapist was and you kind of ticked a box and it all worked out well. So can you just, for the listeners, just give us a little brief run through of what a dental therapist does or what they can do and what your kind of everyday practice looks like?
Okay, so a dental therapist fills the gap in between a hygienist and a dentist. So we can do the whole skill set of a hygienist with additional skills that a dentist can do. For instance, fillings, restorations, impressions, extractions of primary teeth, examinations, x-rays. So a day in my life would be a combination of all those things. Lots of routine hygiene work as well. Most patients need to see a hygienist once or twice or more a year. And then exams, checkups, x-rays, routine x-rays, treatment planning, treatment within the things that I can do. And anything that's outside of the therapist scope of practice, which is things like crowns, bridges, dentures, implants, the big stuff, root treatments, which I don't want to do anyway, so that's fine, gets referred onto the dentist. So that's how my day works. I just see a variety of different patients needing different things.
And that's not always the case with dental therapists. It's not always the case that you're using that full scope. Is that right?
Absolutely not. It's rare at this point to find a job where you can use your full scope. Lots of practices utilise a therapist on referral, and that's indeed the way you need to work when you're working under the NHS. So the patients will see the dentist first, and anything that falls within the therapist's scope of practice, so of that list of things I just said, the dentist will then refer to the therapist, and the therapist will complete the treatment and then send back to the dentist for their next course of treatment, their next exam. And that works in lots of practices. So therapists can do the more simple, let's say, work, freeing up time for the dentist to do more checkup, more exams, more of the big things, more of the root treatments, the crowns, the bridges, the things that they need to be doing. So it's just using the skill set properly.
So you studied here at the Eastman.
I did.
So you then qualified and you went out back into the big wide world. If you cast your mind back and you think about those early stages as being a therapist, if you had to describe those in 3 words, what 3 words do you think you'd use?
Excited.
Okay, that's good.
Relieved that I'd made it. And there was definitely a degree of fear that somebody was going to tap me on the shoulder and say there'd been a mistake and I needed to give back the qualification because I didn't really know what I was doing, I felt.
Okay, interesting. You want to build on that a little bit?
Not that I didn't. Obviously, I did know what I was doing because I went in and did it. But yeah, I think because you're so looked after in college, someone's checking, someone's just making sure that you're doing the right thing. You've got people to ask and then to go, oh, okay, you're all right by yourself. It's like, well, no, I'm not. So yeah, it was daunting.
It's like passing your driving test when suddenly
you
could drive a car on your own and you think, I don't think I'm good.
Yeah, actually, you probably
that probably shouldn't have happened either, if we're honest.
Only really start to learn to drive when you're driving solo, aren't you?
Yeah, I'm sure everybody can resonate.
Yeah, and exactly the same I would say in this job, except you really do need some support before you go solo. I think it's difficult to know that you're doing the right thing, I think.
Yeah, you've got that patient in the chair and there's an expectation there, isn't there, with the patient?
Yes, yeah.
And do you feel like you had that support? I know now there's this kind of opportunity for vocational training and having that kind of extra year of support. Did you feel supported to start off with? Do you think it's important to have that? Yeah,
may I say that I think that is amazing that that's now happening and people can have that support, because I was pretty lucky to go into a locum community job in London where I had a really, really good senior dental officer. So a few days a week, she was available to ask me. So for particularly the therapy side, I was eased in. That was really great. I don't know if I would be doing therapy now if that hadn't have happened.
Yeah.
Which sort of brings me on to my next point. You've clearly been around a lot of practices. You know, we said in our introduction that you've been in perhaps as many as 30 locations in 25 years. I find that particularly fascinating because I'm somebody that's only had 2 jobs. So I went to a practice straight from qualifying, and then 15 years ago I set up my own practice. So can you sort of tell me whether I've been, you know, not that I've been doing it wrong perhaps, but perhaps talk through your rationale for what might be considered moving around a lot and me staying very still, because I think our listeners would have some interesting points to say about both of our situations, wouldn't they?
Okay, and maybe I should add 30 is probably the right number, maybe more with locum positions. And when I tell you that in 2 of my jobs I stayed 12 years and 18 years, then you can realise that actually I moved around a lot in some places. So I would say there's
obviously a lot of locum jobs around. That's also
locums for the first few years, and then lots of jobs where I stayed 2 years, 3 years. There were crossovers. Obviously, we work a day a week here and a couple of days a week here, so it's not moving full time.
Do you think locum work's a good thing to do?
I think locum work is a great thing to do in the beginning. I think it's a great thing to do because you get to have a look. You almost get to interview practices on the job, because lots of the locum positions I did, I got offered a job immediately.
Yeah.
So, and then I said, no, I'm not looking at the moment, but I'll do another 4 weeks with you on a Wednesday, because you get to test a practice. So, I think locuming's a great idea. At this point, I don't know if I'd want to do it because I would specify I wanted a nurse, and I don't know how many locum positions have a nurse. But yeah, I think it's a great way to have a look around and see what's out there. And I did get jobs from locum positions.
I'm sure working in those different environments, there's different equipment, different staff, different philosophies of how practices are run, how dentistry's done. So I know you've talked about a couple of things already there, but what experiences did you amass from all of those different situations?
Oh, crikey, that's a big question.
You've got plenty of time.
I've worked in practices that have got all kinds of different philosophies. Ones where they're a really, really close-knit team and they all work together and everybody helps each other, and ones where they barely even speak to each other, and God should help you if you ask someone to go and get you a suction tip because it's not their job. I mean, and I can give opinion that obviously I know which one's better. Yeah. And I would say, I think we missed a bit as well, because you said about you, I'd like to just go back to what you said about you being the wrong thing, being in a long practice, and maybe, can we just go back to that?
No.
Because you said people might have something to say about you being in just 2 jobs and me being in 30 jobs. But I would say if you've been happy in those 2 jobs, then there's absolutely nothing wrong with that. Why do you need to change something that you're not happy with? That you're happy with? Why would you change it?
Yeah.
The only reason we change things, well, maybe I'm a little flighty, but you change things because you want change. If you don't want change, then there's nothing wrong with that. That's great. I'm actually intending on staying in the job I'm in now till I retire. That's my plan. And they know it.
And are delighted with that.
Well,
news.
I hope so. They're going to have to push me out the door.
So were you looking for something in particular when you were kind of going around, or were you just looking for experience to see which one took your fancy? If you know
when I was locuming?
When you were locuming?
I think when I was locuming, I wasn't. I was just filling the early days of being qualified and testing the water, really. Most of my locum was in London. I did some around the areas in Kent. I wasn't going to locum particularly to look for jobs. I was really just filling the time while I decided where I was going to be.
And then now later on, you said you've ended up at a practice that you're happy and you want to stay with.
At the best practice ever, in my opinion, and really happy.
So was those last few jobs kind of looking for that practice?
No, I wasn't looking for this practice at all. In fact, I very nearly turned down the job because I didn't want to work any more hours than I was working.
Like a love story, doesn't
it
sounds
really,
like one of those.
Yeah, I was. At the point I found this job, I was actually only working a couple of days a week in dentistry. I'd cut right back. I was a bit disillusioned and I was happy with what I was doing elsewhere. And this was a maternity cover. And I said, I'm not interested. I'm busy. I don't really want any more days. And the person who'd called me about it said, I think you should just go and meet the practice, which I did. And that's 5 years now. And I'm just about to be full-time there.
So obviously we've been talking about your career and, you know, it is extensive and you've got a lot of experience. So think back to perhaps giving advice to newly qualified therapists and hygienists for that matter. What sort of advice would you give them in this new environment that we're all working in? And I say new because I think it is changing and has changed very rapidly in COVID times.
Okay, I could give so much advice. Don't chase the money. The best paid job isn't necessarily the best job.
That's good.
The happiness is, I know it's a cliche, you can't buy happiness, but actually you can be paid mega bucks and be very, very unhappy going to work, which makes you very unhappy in the rest of your life, or you can be paid decently, which, let's face it, we are. Our jobs that we're lucky, we've got a really good job, but maybe not the top money, and just be happy. So don't chase the money would be my first bit of advice. Don't take a job without a nurse would be my next one, ever.
I think that's really changed. I mean, I think, we've talked a little bit about that with other guests on this podcast, and I think it would be fair to say that has been one of the most resounding things, in my opinion, that's come out of COVID.
Absolutely what I was going to say. If COVID has done nothing else, it's just made people change. Lots and lots of people were, practices, us, we're just quite happy plodding along as we were, and it's made us change. And now so many people have experience working with a nurse, they're going to fight to keep them, and so they should.
So I think you make some interesting points about COVID and working with a nurse there. And just a little story to share is that I remember one of my patients who moved with me to my independent practice from my previous place. So I'd worked with this patient for the last 17 years, and he came to see me in my new practice and said, "Ooh, what's that person doing in the corner of the room?
Is that a trainee?"
And he said, "Is that one of your students?" And I really was trying to think of, there's so many things I could say in response to that, but the first thing that came out of my head is, actually, she'll help me resuscitate you if something happens. So she's very important.
Fair enough.
Which might have sounded a bit sarcastic, but actually this person does a whole host of different things. But that will be the most important thing that you might consider her doing for you.
Exactly, yeah, definitely.
So,
I can't even imagine working without a nurse now. I can't begin to tell you how much. Well, my nurses do everything for me as well. I'm really spoiled. They literally do tidy up the destruction behind me. I dictate my notes, which I think for patient motivation is one of the best things that you could possibly do.
I've heard a lot of people talking about this.
My nurses, so I've got my pro forma, which is obviously, you can tell an Eastman girl from their notes because we all do our notes exactly the same. I can tell if I'm following on, but my which is, it's grown considerably in 20 years, my pro forma, but the nurses call out.
Nothing the matter with that, Rachel, is your ex-tutor.
The nurses will call out the title, so the bit before the notes, and then I will dictate what I'm going to say. Well, there's nothing more motivating than saying diagnosis, periodontitis unstable, or gingivitis, bleeding, and they'll say bleeding score and they'll read it back to me. So bleeding scores 15% today. Last time it was 12%. The patients know exactly what's going on in their mouth, and that we're recording it, that their bleeding scores always go down.
That's really good.
It's really motivating. So yeah, that would be a big bit. Have a nurse take your notes, let the patient hear what is being written about them, and it's a great motivator.
If you had to think about one lesson that your role as a dental therapist has taught you that you think that every clinician should learn at some point, and I know we've kind of covered a few areas that might answer this question already, but what would that be? One thing that you've learned that you think that everybody should learn at some point?
I think the biggest lesson is, if you're not happy with something, then it's your responsibility to change it.
Yeah.
You can't be unhappy with your own unhappiness if you don't do something about it. So yeah, you've got to just take the confidence to change things, and if they won't change, then you need to change, which probably explains why I've worked in so many different practices. But there you go.
Well, so that sort of stems on to what I might have been asking you next, is that you've obviously come across lots of different people in your time. So who have influenced you? Who have been these people that have shaped you and made you the person you are and impacted your career journey?
Do you mean clinically?
Well, not necessarily, actually, because I think, after all, I always say to people, I'm nothing without my patients, my students, my colleagues. We're nothing without all of those people. But if you can think of particular...
there's so many people that have influenced me. I worked in West Kent community dentistry for 6 or 7 years, had an amazing senior dental officer who was just brilliant with the patient. She could do anything. She could do anything. She would help. She was blooming scary. She knew her stuff. We used to call her the Oracle, but she was just inspirational, absolutely inspirational. She could get any patient to do anything and do it well. So I always used to say then, when I grow up, I want to be like her.
And do you think you turned into her?
Definitely not as good. Trying.
Oh, come on. Big yourself up.
No. I'd love to be, but no, some people are just exceptional, aren't they? I'm halfway there.
Well, hey, we're all life in progress, aren't we?
People that have shaped me, there's lots and lots of dentists that I've worked with who've operated an open door policy with me and allowed me to go and ask for advice and look at radiographs with them and discuss what the treatment plan might be and what's going to be the best way to approach. I've had a number of people like that in my career, which has just been great for me. Great. And they're the ones you need to look for.
Yeah, I think that's important to hear for dentists listening, and anybody that's more experienced. Just take the time to, speak to your colleagues and give them help and guidance, because, as you're saying, it's a really beneficial thing and people really appreciate that. So
yeah, I really think it's very easy to forget those first few years, and I can't imagine that the dentists were any different from us. They didn't come out knowing everything,
well, I don't
being
think
able
in the
to.
medical world
No one comes out of anything knowing
way.
it all, and I think it's very, very hard to forget, and it's very easy to judge other people's work, how they're doing things without guidance, because they've never known any different. So yeah, they're the practices you need to look for, the ones that are going to just hold your hand a little bit. And I'm 20 years qualified in my therapy career, and I still need that. I still need to be able to go and talk to my boss next door and say, what would you do here? What do you think?
But I think all of us need to do that.
I think everybody.
I think that's the joy of things like study clubs. That's the joy of professional societies. That's what conference is.
Yeah.
And I think that's probably one of the biggest things that we all missed during COVID, wasn't it? Those conversations that you have, in the coffee breaks, at the lunch breaks, in the evenings are enormously valuable. I think, sometimes we underestimate the importance of those sorts of things. Obviously, it's always good to go there and listen to great information, read information in journals, but actually that whole interaction, listening to somebody saying, actually, do you know, I've had the same problem, or how have you got on with that dental material, or what's gone on for you with that new electric toothbrush or whatever. So
yeah. And I think when you go to conferences and lectures and things, you see people presenting their best work in the best way possible, and you just do this and this, and you've got this. And in reality, that isn't how it worked for them the first time, or the second time, or the third time. Indeed, it probably took them 20 times to get to that point. And you can feel a little inadequate when you look at your own work and think, well, that didn't turn out quite like that. It's not I don't know, I'm particularly cons work, I'll criticise it. People will say that looks good, I'll go, oh no, I could have done this and I could have done that. There's a lot of self-criticising.
I have a wonderful patient who I've looked after for 33 years, and every time he comes in to see me, I think, goodness, if one of my colleagues had a look at this patient, they'd go, so you've been seeing Julia Bruin for 33 years. So what has she been doing for you? And I would say, you know, he's still got the same teeth. He's got this. Okay, it might not be perfect, but my goodness gracious me, you know, we're still in a good position there. So, or we might have only lost a couple of teeth. No names mentioned, of course.
Well, that's real world. That is real world. So similarly, along that same line, you must have come across a whole host of different patients in that time period. Are there any particular patients that are memorable and stand out, or have maybe, you know, taken your heart a little bit, or maybe influenced you, or made you think about things differently? I
love my patients. I literally love my patients. I find all of them interesting. The ones that come in to see me grumpy and not happy and don't want to be there, I feel proud that after a couple of years of blinding them with niceness, they have to be nice back to me, and they'll be friendly in the end because I'll make them. But yeah, there's so many inspirational patients that turn their lives around, children that do amazing things that you would never imagine they could do, but they just do it. Yeah, patients are great. I love them. I think, that's why I do it, is the patients. And I think that's why I didn't stay in community, aside from the fact that it's terrible pay. The patients were great. The paperwork and the tick boxing and the amount of time wasted around not seeing patients was what drove me out. And that's the problem. We can get into the NHS problems, but there you go. That's why.
I think
because
that's for a whole other podcast.
Yeah, I want to be seeing patients. And that's why I don't own my own practice either. I want to see my own I just want to see patients.
Yeah.
Don't want to deal with the admin, COSH reports or whatever they're called these days, and all the fluff that goes round.
Yes, and there's a lot of fluff, isn't there?
Yeah.
So, I mean, you're saying that you didn't want to set up your own practice, which is totally fair enough. I mean, you're 20 years into this dental therapy career. What do you think dental therapy is going to look like in another 20 years?
I think therapists are going to rule the world. Really, I think now's the time. I don't think there's ever been a more exciting time to be a therapist than right now.
Yeah, I agree.
Like, people are realising who we are. Not quick enough. I mean, we're 20 years since I sat in the House of the Parliament, because I was there when that decision was made that therapists could work out in general practice. And still, I say to patients all the time, because I'm a dental therapist, I say, have you seen a dental therapist before? And they say, what's a dental therapist?
Yeah.
So we're a long way to go, but...
And you were there, you said?
I was there.
Wow,
I was
what
there
was that
in the Houses of Parliament. It was exciting. That was really exciting times, because that changed in my final year of uni. As far as I was concerned, we were going to be constricted to community to be a therapist forevermore, and that changed while we were there. And the local ID blocks, because we had to rush all those in for the last term. But yeah, that was a really exciting... So leaving uni at that time, the world was our oyster. Obviously, that isn't how it worked. It's still not 100% our oyster. It's taken 20 years to get to the point where I really think practices are actively looking for a therapist, rather than going, what does a therapist do?
Yes.
Just send her all the kids that we don't want to see.
Yeah.
So along those lines, if you were thinking about the dental industry as a whole, is there anything that you think that we should all stop doing or anything that we should all start doing? What were your thoughts on that?
We should start educating people from birth, educating parents from birth. There's a lack of education in this country. Let's face it, dental health is not getting better in this country. It's getting worse, and that's wrong. We've got so much information. We know so much about health, and the information's not getting out there. It shouldn't be that the first time I see a child at age 3 or 3.5 that I'm telling a parent that they shouldn't be eating raisins in between meals. That's ridiculous. Yeah. But it's not out there. The information's not out there. Parents who are doing the right healthy thing for their children are not doing the right healthy thing for their teeth. Yeah. So that needs to change. We need better education right from the start. Including flossing. I mean, why aren't we teaching children to floss from age? I start them from age. We start our children at our practice on annual hygiene visits from age 12. So they're flossing from age 12. It could be argued they could do it earlier than that. I think popping out baby teeth with floss probably isn't the most motivating thing. But if we get this information out when they're young, then we're going to have healthy people. So there's a couple of things we should be doing. How we do it
again, I think that's the end of the day.
I'm not going to go and lobby in Parliament to get it done, but there's a lot of things aside from the fact that dentistry needs to change as far as government goes and country goes. It needs to change fundamentally from an education point of view as well.
You've talked about during this podcast how lucky you feel and perhaps how fortunate that you feel that you are now in a practice that you really are going to be in till you stop working. Can you try and think about the advice that you might give a colleague who's in a career rut? In other words, is perhaps not in such a fortunate position as you, is feeling troubled with what they're doing. What sort of advice would you give them?
Well, I've been there, clearly, lots and lots of times. Lots of times I've been not wanting to go to work, not wanting to even do dentistry at a point because I was bored and it wasn't working for me and I didn't like the situation. Yeah. The only person who can do something about that is you. There's nobody who can fix those kind of problems for you apart from you. It just takes a little bit of bravery, which is easy to say, not so easy to do. Confidence in yourself, to know that there's better there. I know there's better there. There's better there for everyone. And if there's not better there, then you've got to change it and find it, because people treat you the way you allow yourself to be treated, is what I would say. And then you've got two choices. You've got to stand up for yourself or you've got to walk away.
So if you think back to the start of this podcast, we asked you the 3 words to describe those early stages right back at the start when you were a dental nurse and just starting out in dentistry. What 3 words would you use to describe your career now and the position that you're at now?
I'm happy, privileged, privileged, definitely privileged. I mean, who gets to go and do the job that they love to do every day and get paid really well for it? Because it's a good career. I'm privileged, really privileged, and content, I suppose, would be another one.
How lovely to hear those That's 3 great. Words.
Yeah,
that really is inspiring to our listeners, because that's really what we're trying to get people to get out of this podcast.
But you've got to maybe work in 30 practices to get there.
Well, but but like you say, you've done a bit of locum stuff, and it hasn't always been,
No, and the 2 practices that I was there for a long period of time, the 12 years and the 18-year practices, were unfortunately, let's say, both bought by the same person. So I started both of those practices with 2 different bosses, and when I left, they were both under the same boss. So when you're not happy in one, the other one's going to go as well. So that was an unfortunate situation, let's say. But it moved me in a direction that I've now I'm in a position where I'm really happy.
I think everybody in dentistry's got a happy accident, hasn't it?
Yeah, everything for a reason. I think
we've got all sorts of stories we can share with
definitely that. Everything for a reason. Sometimes it's hard to see what the reason is, and leaving a practice under a shadow is not a pleasant experience. There's a lot of self-questioning and...
Well, it's also a small world out there, isn't it? One gets a bit nervous about doing these things.
Yeah.
But you're proof that there's that end point, and if there is a
let's
low,
hope so.
Then there's a high to come,
definitely.
and I think it's important that our listeners remember that as well. It's been an absolute pleasure speaking to you. Thank you
really
so
great.
much for
Thank you for your contribution. It's been great.
Thank you.
We hope you've enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe and listen out for future episodes.